Senior Criminal Defense Counsel tells the story of Sue Rodriguez. Sue Rodriguez, a Canadian just received the news that she has ALS, a degenerative cell disease, which leads nowhere but to death. At the age of 41, when she got diagnosed. Her options are assisted suicide or to die suffering. And she pleads with the Canadian government to allow her to die. If you had to make this decision, what would you say on behalf of Sue? It's a pretty heavy question. Many people have studied and published on the topic of assisted suicide around the world. The physician-assisted suicide is a topic many are unwilling to discuss, but with a long history, it still affects the lives of millions of mentally and terminally ill patients around the world. Assisted suicide has many names, such as assisted dying, physician-aided suicide, medical assisted suicide, and sometimes euthanasia. I'm really referring to this as PASS, physician-aided suicide. But it is very different than euthanasia. Euthanasia is when a doctor ends a patient life from suffering. It is usually done by a lethal injection. And assisted suicide is when a patient actively seeks out somebody to help them die. And that is done by a self-administered drug. The American Sociological Association states that assisted suicide was first brought up in the United States in Ohio with the euthanasia bill, but it was ultimately shut down because it was in 1907 when that was still taboo. In 1947, a Gallup poll shows that 54% of Americans disliked PASS, and then from then on, PASS had a steady growth until it plateaued in 1990. Oncologist and bioethicist Ezekiel Emanuel stated that the dominant motives for PASS are loss of autonomy and dignity and being less able to enjoy one's life. PASS and euthanasia requests are usually driven by mental health issues such as depression, which makes psychiatric evaluations very important in this process. More than 70% of patients that request PASS are dying from cancer. And in Belgium, pain is the reason for more than 50% of PASS cases. Palliative and hospice cares can play a big role in this process. Oregon reports that between 1998 and 2015, 87.2% of cases were enrolled in hospice care. And in 2013, a study in Belgium found that 74% of euthanasia cases had received palliative care service sometime before their death. Okay, we're going to take a look at this picture. It's very confusing, but this is the steps of how to really, from asking to get PASS to the final you dying. So I went to the official Death with Dignity website to kind of dumb down for me because that doesn't make no sense. The Death with Dignity website explains the process in the United States, where two physicians must confirm the patient's residency, diagnosis, prognosis, and mental competence. There is 2 waiting periods, a total of 17 days, the first between the oral request and the second between receiving and filling the prescription. The patient must also have, in the US, the patient must also have a terminal illness that will kill them in 6 months. In the Netherlands and Luxembourg, there's no mandatory waiting period, so you can just walk in and say, I want to die, and they're like, okay. Belgium requires a 1-month waiting period and a psychiatric evaluation for non-terminal ill patients, which is a very important step because psychiatric evaluation isn't common. Emmanuel also states, for adults in the Netherlands, Belgium, and Luxembourg, require that patients have unbearable physical or mental suffering without prospect of improvement. And in the US, Canada, and Luxembourg, you have to be at least 18 to request PASS, but in the Netherlands, you can be as young as 12. You just have to have parental consent. So, places to go where you can get assisted. Assisted suicide is legal in California, Oregon, Washington, Hawaii, Maine, New Jersey, Vermont, Colorado, and the District of Columbia. It is also legal in many countries such as Switzerland, Luxembourg, Belgium, Canada, Colombia, and the Netherlands. So basically, this is all the red states are where it's illegal. Can't do it there. But the pink states are where they're contemplating, should they make a law, should they not? And the blue states are where it is legal, and Montana is kind of special because it's neither legal nor illegal. You just have to go through the long process of asking the government of that state, and they can decline you or they can say yes. Let's say like this one, all the green countries are where it's legal, all white countries where it's illegal, and orange is where we're still iffy about it. So some popular disagreements are the slippery slope fallacy. It's commonly used when referring to this expansion of potentially ending life of a patient who did not make the request. This argues if you legalize PAS, it would lead to the legalization of euthanasia, which has already happened in the Netherlands, Belgium, Canada, Colombia, and Luxembourg. So it basically says that you could go from being extremely, like where it is now, you have to have a terminal illness, to just being old and wanting to die if it just trickles down. The legalization could also lead to other laws, such as the power of attorney asking for a pass on your behalf. Or in New Mexico, the Alyzabeth Whitefield and the Black Option Act is allowing patients with mental illnesses to ask for pass. Peter Hetzler, a plastic surgeon who specializes in breast cancer patients, says there's also a considerable concern for minorities, poor, the disabled, and socioeconomic marginalized group who are pressured into receiving PAS. This had already happened in California, where they're also worried about health insurance companies taking advantage of this. As a woman in California has cancer, she had cancer, and her health insurance refused to pay for her cancer, but when she asked for end-of-life medication, they paid with it, they paid for it, and she only had to pay for $1.20 copay. And also religious views are a very popular thing for this. Many physicians say that religion as a reason they will never aid someone in their death. Sentiment many outside the field of medicine also share. Some who oppose assisted suicide cite one Michigan man as their main concern for not legalizing PAS. Dr. Jack Kevorkian. Timothy Murphy, a professor at University of Illinois Chicago of Medicine, writes an article about Dr. Jack Kevorkian. He is more commonly known as Dr. Death. From Michigan, he aided his first suicide in 1990 to a woman who had ALS. He continued aiding patients in their death until 1999, when he filmed the death of Thomas Heald, sent it into the station, and they put it on national television. He served 8 years in prison for Thomas Heald's death. He also has mercytrons, weird name for his machines. This is how he would kill them. He would sit them, have like an IV in them, he would put saline so they would go into a coma, and then he would give them a lethal injection. And if he got consent, he would do experiments before they died and on their cadavers after they had died. Murphy states that Kevorkian found a number of men awaiting execution who said they were perfectly willing to volunteer for experiments prior to their execution. And although this is an extreme example of the consequences of legalized assisted suicide, it's still a story to be taken into consideration. The thought of losing a loved one would be terrifying, but it's important that we are educated on the role assisted suicide plays in the lives of mental and totally ill. Now when you look back on the story of Sue Rodriguez, you may be shocked that her request for death was declined, and she suffered for 3 painful years, which only led to her inevitable death. Assisted suicide continues to be a widely disputed process all around the world. Thank you.